Heart patients in rural and regional Australia could be left with huge out-of-pocket costs after the Department of Health quietly announced a swathe of changes to cardiac imaging services. New restrictions on some forms of imaging could see patients left with a $900 medical bill from a single scan. The changes to the Medicare rules come into effect on the 1st of August and will affect patients outside the big cities. For more, I'm joined by Peter Tuwali, who's the Director of Telemed Nuclear Imaging. Thank you so much for your time. You're joining us from Albany in Western Australia. Just talk us through the scans in question and how critical they are for heart disease patients.
Sure. So the heart scans are called Myocardial Perfusion scans, and they're a branch of nuclear medicine, and they've had a long established role in investigating the coronary tree, or the plumbing to the heart, if you like, to determine whether there's any serious blockages. And they're quite an important play quite an important role to help cardiologists and their doctors, GPs, to determine whether the patient needs surgery or some other type of medical management.
So what are the Medicare changes?
So Medicare is undergoing a massive review, which I think most health professionals are quite supportive of, and there are a lot of sub-branches to that, but in particular on this issue, which is concerning, relates to cardiac scanning and myocardial perfusion scans. And at the present time, if a GP, I'm in Albany, if the emergency doctor wishes to do a heart scan, or the GPs or other doctors, they can order it and the patient will receive it in high bulk bills, so they'll have no cost whatsoever. What happens after August 1, we've been told, is that that patient will only be allowed to have one of those studies once every 2 years, and quite often, particularly in the rural areas where there's an overrepresentation of high levels of cardiac mortality because of lack of access, we see patients that need these scans more often because there aren't any alternatives. And so after August 1, patients that need another scan because they've had re-emergence of symptoms or there might have been complications won't be able to get a Medicare rebated one, and they could be forced to pay significant amounts just so that we can offer the test.
So what will it mean for patients, particularly those who can't afford the out-of-pocket costs? Will they simply go without the scan?
I think some will. Farmers and mining people can't sometimes leave their location. Certainly Indigenous people, population, find it difficult to really move to Perth. It'll be a challenging dilemma for the doctors that I serve. They will need this test to help them. If they can't access other studies, it'll be a dilemma, and I really fear there'll be some quite adverse events if we can't stop this measure.
So you said this change comes into effect on the 1st of August, but when was it announced?
Well, it's very difficult to get much information. A lot of my colleagues only discovered this on Sunday in a medical forum, and Monday we had a webinar with hundreds, I think, of stakeholders trying to ask questions, which they weren't. So the consultation process, I think, has been quite flawed or could be improved, and people like myself in these clinics, this is the scanner that we use, haven't really had an opportunity to tell them what goes on at the clinical coalface. Most of the committee has been represented by metropolitan professionals, and we don't think that particularly the rural voice has been properly heard. And we don't think that, looking for savings with Medicare, that restricting scans on people that really need it is very smart. And so we hope that there'll be a greater review.
Do you think this has been slipped through because the national focus health-wise is on the pandemic?
Well, I'll lead others to come to that conclusion. I'm not sure. I haven't become that cynical yet. I hope not. I think the department wants the best for patients, and we need to have a sustainable Medicare. So we all support them in that. It just seems that not all of the right information may be going to the decision makers, and ideally hope that the Minister's office will work closely with the department and us just to try to get the right balance, because we shouldn't be, jeopardising people's health, particularly in the regions.
Yeah, so what's the next steps here? Will you be making those outreaches to the Minister, and is it too late to have these changes reversed?
I hope not. We have made, certainly rigorously made some submissions to the Health Minister's office, and they've been very receptive. And I think the Health Minister is genuine in his comments. He doesn't want to see any adverse events. We've sent some messages to the department, and hopefully they will get back to us and give us some clarity, because there really is widespread confusion. Having patients only be able to access scans, once every 2 years for these particularly vital scans where there's not much alternative, and having to either seek specialists in a very complex way, it just isn't a smart way to go, we don't think. And so we hope that there'll be some urgent stakeholder meetings after the next couple of days.
Peter Tuelu, we appreciate you taking the time to speak to us tonight.
Thank you so much.